Let me first share the session format today. We will have a presentation of which will be for 30 minutes. And after the presentation, we will have 15 minutes for Q&A, but that is flexible. So if the talk goes over, we will just cut down on the Q&A part. So we are talking of a total of 45 minutes. And now first, let me just start by saying that the topic today is why yoga, your health, your choice. It is about the lifestyle choices that we make to boost our health. And by lifestyle, we do not mean the brand of sunglasses we wear or the branded shoes or the car we are driving. By lifestyle choices, what we mean is whether the food that we are eating, the diet that we are taking in, are we aware of that? The amount of sleep, the physical activity, and whether we have smoking and drinking habits, and how being informed about them can reduce our health risks and potentially add healthy years to our life. So let me welcome our distinguished guest, Dr. Rima Dada. She joins us from New Delhi in India, where it's about 8:30 p.m. right now. Dr. Rima Dada has an MD and a PhD in genetics. She works at AIIMS, which is the short form for All India Institute of Medical Sciences, and that is the best and the premier institute of medical science in India. She is a faculty in charge of Molecular Reproduction and Genetics facility, and she has conducted research on genetics of reproductive disorders and ocular disorders, as well as her research is on impact of yoga in complex diseases and genome and epigenome. She is the recipient of several national and international awards. She has delivered over 150 lectures, and she has published over 170 indexed papers and over 300 abstracts in scientific meetings. So without further ado, let's welcome Dr. Rima Dada.
Thank you. Should I share my slides?
Please go ahead.
Can you see my slides?
Yes.
Yes, Rima, we're seeing everything fine. Please go ahead. Okay.
Thank you, Dr. Sarkar, and thank you to Abha for inviting me to deliver this talk on a topic which is very near and dear to me. I would be talking on why yoga and your health, your choice. And why I selected this topic was, just 1 minute.
What happened?
The reason why I selected this talk was that it's very important for us to realize that though we are brought up with this concept of genetic determinism, that our genes determine our destiny, our health and disease states, but it's important to know that there is something which is operating above the genetic landscape, and that is the epigenome, which is highly dynamic, and it changes depending upon our habits, our thoughts, our diet, and our lifestyle. And therefore, our choices actually determine our health and disease states. It's very important to understand that this is really empowering, that we cannot blame our genes. Those certain mutations do cause a particular disease, but in majority of these complex lifestyle diseases, which have shown a significant increase in the recent decades, there are a number of genes which come into play, and each gene has a small additive effect. They are not causal. They just increase your risk or susceptibility to develop the disease. And you can change the output and the expression of the genes based on your choices, your thoughts, your decisions. And therefore, good habits like practicing yoga or having whole plant-based, unrefined, unprocessed foods, which are gene programs which are beneficial for us, whereas having an inflammatory diet, stressful thoughts, always automatic negative thoughts, they switch on gene programs which cause inflammation upper stage for developing chronic diseases like autoimmune diseases and cancer later. So I would first be talking about complex diseases and how yoga, a mind-body medicine, is the need of the hour in this age of super specialization, where there's a highly targeted approach on a particular system, and how these diseases have a strong psychosomatic component and thus impact every cell of the body, and how yoga actually acts on the DNA as well as the RNA on the genome and the epigenome, and can switch on gene programs which are beneficial for us. And thus yoga not only promotes health, can prevent the onset of diseases, and is an excellent rehabilitative potential and has tremendous transformative power. So I just wanted to show you that why there has been a huge increase in the incidence of complex lifestyle diseases, largely because we have become shifted from a hunter-gatherer society to a society which is largely sedentary, a society which is having a diet which is highly inflammatory, rich in trans fats, salt, sugars, highly processed, refined, and that has led not only to the epidemic of obesity, overweight, but also a huge number of complex lifestyle diseases, be it ischemic heart disease, depression, diabetes, hypertension, stroke, primary open-angle glaucoma, cancers. They all fall in the category of complex diseases. So the first example I'll give is of unexplained male factor. Yes?
I've had people to move it to presenter view. I don't know if you could do that. Sorry to interrupt your flow though.
I was trying to do that, but then the slide was not moving. Just 1 minute.
There you go. Thank you. I appreciate it.
Okay. So first of all, I would be talking to you on unexplained male factor infertility. Now, infertility is believed to be a problem, largely the women are blamed, but it's important to understand that in approximately half the cases, the problem actually lies in the male. And especially in cases with unexplained male factor infertility, where the sperm count, motility, morphology are normal, it's been seen that they have high levels of oxidative stress and DNA damage. Now, what is oxidative stress? It is a condition in which there are a high number of free radicals and lower antioxidant capacity, and that is largely due to psychological stress, exposure to a lot of endocrine disrupting chemicals like phthalates and insecticides and pesticides, smoking, excessive use of cell phone, alcohol consumption, a highly inflammatory diet, and high intake of non-veg foods, which have a lot of endocrine disrupting chemicals built into the animal's protein. So one of the largest causes of people resorting to assisted conception and test tube babies is male factor infertility, and sperm DNA damage is the single largest cause of defective sperm function. And it's important to understand that the more we use assisted conception in one generation, the more we would need in the next generation. And of all the cells in the body, the sperm is a cell which is most vulnerable to environmental insults and oxidative stress. The reason being, during its development, it sheds off majority of its cytoplasm, and thus the antioxidants are also removed, and there are minimal antioxidants to combat oxidative stress. And the sperm develops a highly compact nucleus so that it can travel in the female reproductive tract, and therefore its size of the nucleus is very small. And since majority of its DNA is highly compact, its DNA repair mechanism is largely silent. So any damage that the sperm accumulates does not get repaired, and it is dependent upon the oocyte to clear its damage. Now, when couples delay the age of parenthood, the oocyte's repair capacities also may not be optimal. And another thing, when the damage is extensive due to changes which have been accumulating over a period of time, that damage may not be totally cleared, and that passes on to the offspring, resulting in a huge number and increased incidence of genetic and epigenetic diseases in the offspring, as is seen in children who are conceived through assisted conception. So in our studies, we have actually found that advanced paternal age, a large number of factors which are modifiable and preventable, like smoking, excessive use of cell phones, psychological stress, results in oxidative stress. And as the sperm cannot combat this damage, this actually damages the mitochondrial and the nuclear DNA, resulting in DNA fragmentation, shorter telomeres, so accelerated testicular aging, and accumulation of various adducts which induce epi-mutations as well as mutations, de novo germline mutations. Now, one of these markers of oxidative DNA adduct is 8-hydroxy-2-deoxyguanosine. And we quantify this base to know what is the level of oxidative DNA damage in the sperm. And as I tell you, this DNA damage is not cleared. Therefore, this is actually the cause of not only infertility, recurrent spontaneous abortions, congenital malformations, but also the cause of childhood cancers, complex neuropsychiatric disorders, and dominant genetic diseases. 75% of de novo germline mutations arise in the sperm DNA. So we've quantified the free radical levels, and we find that a large number of men have levels which are much higher than the cutoff level. So the sperm is experiencing seminal oxidative stress, and optimal free radical levels are required to maintain the telomeres, which are the guardians of our genome. And it's been seen that when the levels are too low or too high, they cause rapid attrition of the telomeres. So the sperm tends to age faster. And in addition to that, we've seen that, as I told you, we quantify the level of DNA damage. Not only do we determine is there DNA damage, but what is the cause of the DNA damage? And we quantify the level of this base, and we've seen that the level of this base is much higher in the fathers of children with sporadic cancers like retinoblastoma. This results in de novo germline mutations and epimutations, and is the cause of post-zygotic mutations, which is responsible for certain cancers and other genetic and epigenetic diseases. So we did this study where we actually studied the impact of antioxidants on the sperm DNA. And though we find that there is an improvement in the sperm motility and due to the change in the membrane characteristics by taking antioxidants, but there is really no change in the DNA fragmentation index. So the sperm DNA quality or integrity does not improve by using these antioxidants, and very few antioxidants at therapeutic doses is able to actually impact the DNA quality, though the sperm membrane characteristics do show an improvement. And therefore, we studied two cancers, retinoblastoma and leukemia, and we find that the father sperm had high levels of oxidative stress and DNA damage. Now I'll talk of the impact of yoga on the sperm genome and the epigenome. So when we did this study, we studied the impact of yoga on 10 days, 21 days, 90 days, as well as 180 days. And we find that the free radical levels actually show a significant decline just within 10 to 21 days. And this decline in free radical levels results in a decrease in the oxidative stress, which also occurs because of increase in the total antioxidant capacity in the group that practiced yoga, and in the group that did not practice, we do not find any change. Now, this is important because this shows you that yoga has switched on those genes which are coding for antioxidants like catalase, superoxide dismutase, glutathione. So that is how the total antioxidant capacity increases. In addition to that, the longevity genes, which are histone deacetylases, their levels increase. Now, this is very important because this was the first study to show that independent of intake of red wine or caloric restriction, yoga can increase the levels of sirtuins. In addition to that, to maintain the telomere length, we actually find that there is increase in the levels and activity of telomerase enzyme. This is very important because telomeric DNA undergoes shortening due to oxidative stress and decrease in the levels of telomerase. And in the group that practice yoga, you can see there's a significant increase in the telomerase activity. Thereby, yoga is causing a decrease in the rate at which your cells are aging. And we also find that the level of oxidative DNA damage shows a significant decline post-practice of yoga, though majority of antioxidants were not able to act on the nuclear DNA, but we find that the levels of this oxidative DNA goes down post-practice of yoga. In addition to that, it's been seen that oxidative stress actually causes genome-wide epimutations, because we find there's global hypomethylation and there's locus-specific hypermethylation. And this global hypomethylation unmasks the repetitive elements which are spread out throughout the genome and make it unstable. And we found that with yoga, there is re-establishment of those methylation marks. So the levels of 5-methylcytosine go up in the group that practiced yoga, whereas it did not change in the group that did not practice yoga. And we also find that with a decrease in the oxidative stress, there was a decrease in the levels of 5-hydroxymethylcytosine. And again, this was the first study to show the impact of yoga on the sperm epigenome, which showed that various genes which are beneficial for spermatogenesis, embryo implantation, for the formation of cytoskeletal elements, their levels were hypomethylated, and this correlated with a decline in the free radical levels. And we also see here that this is a picture showing you the assessment of DNA damage. Here, each dot represents the sperm, and the number of sperm towards the x-axis are the ones with the damaged DNA. And you can see here that the sperm towards the x-axis actually decrease when you practice yoga for 6 months. Now, the improvement in the DNA integrity takes actually about 180 days, that is about 2 spermatogenic cycles. Now, it's very important to understand that you need to practice yoga on a daily basis, even if you do it for shorter periods, but it should be regular and you should be consistent with your practice. And you can see that this is a technique known as sperm chromatin structure assay, and the number of sperm towards the x-axis has actually decreased post-practice of yoga because of the improvement in, there has been an improvement in the DNA integrity. Now I'll talk about another autoimmune disease, and that is rheumatoid arthritis. And I'll also show you that be it any complex disease, they have some common underlying mechanism like oxidative stress, inflammation, shorter telomeres, dysregulated immune system. Then there is hyperactivity of the sympathetic nervous system and the persistent activation of the hypothalamo-pituitary adrenal axis. And all these mechanisms are targeted by yoga. So as we know that rheumatoid arthritis is a very severe, progressive, painful arthritis, which not only affects the joints, but it also affects other organ systems like the brain, heart, and the lung. And we find that for this, they are given certain disease-modifying anti-rheumatic drugs. And despite this, they have numerous side effects. There are frequent relapses. And we find that, again, this was a randomized controlled trial, that post-practice of yoga, there was a significant decline in the severity of the disease as is shown by the disease activity score, and the severity of comorbid depression also decreased post-practice of yoga. And why did this happen? You can see that the levels of ESR and C-reactive protein have gone down, and the levels of various inflammatory cytokines also show a significant decline post-practice of yoga, whereas a group that did not practice and who was on standard disease-modifying anti-rheumatic drugs, they showed a non-significant change. Now, there was a decrease in the level of IL-17A, which is an inflammatory cytokine, which is responsible for the articular symptoms. It is the one which is actually responsible for inflammation in the joints. The tumor necrosis factor alpha is responsible for synovial hyperplasia, activation of the osteoclast, which causes the bone erosion. And the interleukin 6 is responsible for the extra-articular manifestations. And you can see both the articular and the extra-articular manifestations actually reduce post-practice of yoga because of decrease in the levels of inflammatory cytokines. So they have shown a steady decline in the levels of these inflammatory cytokines. And post-practice, not only was there a decrease in the level of inflammatory cytokines, but the anti-inflammatory cytokine levels went up. In addition to that, in those families where there was a risk genotype, they had a genotype which predisposes them to develop this autoimmune disease due to decrease in the levels of HLA-D due to insertion deletion polymorphisms in this gene. We find even in those genes, there was an increase in the level of HLA-G levels. This non-classical HLA-G molecule has shown an increase, showing that yoga actually helps to re-establish immunological tolerance and causes molecular remission. And again, you can see that even in this, there is oxidative stress and DNA damage, which actually shows a significant decline post-practice of yoga. And a number of genes, not only the inflammatory, the inflammatory genes, but the DNA genes maintaining the DNA integrity, and all 4 domains of quality of life show an improvement post-practice of yoga. And why did this happen? It is seen that oxidative stress and inflammation are major players. And we found that this is the first study again to show that post-practice of yoga, not only is there an improvement in the nuclear DNA integrity, there's also an improvement in the mitochondrial health. And this is because of various genes which are helping to maintain the mitochondrial integrity and also increasing the mitochondrial number. That this key molecule will ATP, the energy production, and decreasing the free radical production, thereby significantly causing a decrease in the free radical levels. Now I would focus on another disease, that is glaucoma, primary open-angle glaucoma. And in this condition, it was initially believed that intraocular pressure is the only modifiable risk factor. Now it's important to understand that recent studies have shown not only intraocular pressure, but ischemia, hypoxia, glutamatic cytotoxicity, oxidative stress, low levels of various neurotrophins, inflammation of the glial cells, and nitric oxide alteration in the levels are responsible for primary open-angle glaucoma. And our studies actually showed that where the anti-inflammatory cytokine levels increase, factors which are helping to maintain the aqueous, these spaces of Fontana and the trabecular meshwork, they actually show an increase. The deposition of these trabecular meshwork bands and the collagen deposition here decreases. And those factors which cause a resistance to the aqueous outflow actually decrease post-practice of yoga. And various factors which nourish the neurons and which decrease the apoptosis of these retinal ganglion cells decrease post-practice of yoga. And in this study, which got published in the American Journal of Ophthalmology, we actually showed that yoga is beneficial. And in those cases who practiced yoga regularly, their surgery was deferred because their intraocular pressure significantly declined. Now I would talk on depression. Now depression in India especially is considered one of the capitals of, within the world with the highest number of cases with depression. And it has now, WHO report has actually shown that in the first year of a pandemic itself, that there was a 25% increase in the levels of stress and depression. And in this study, which was again a randomized controlled trial where there were two groups in grays, a group which practiced yoga, and these were the controls who were just on the antidepressant drugs, we find that post-practice of yoga, there was a significant decline in the severity of depression. Now, why did this happen? We find that a large number of molecules which really nourish the neurons, which are fertilizer for the neurons, like brain-derived neurotrophic factor, DHEA, serotonin, their levels actually increase. Now, this is again very important because this shows that yoga can be practiced by one and all, and we don't need to be depressed to practice yoga, that if anybody practices yoga, you can increase your concentration, competence, confidence, clarity. You can increase your awareness and enhance your attention. And decline in the levels of serotonin actually is responsible for depression. And most commonly sold drugs in the market are serotonin analogs, and they have so many side effects. But post-practice of yoga, you can see that the serotonin levels increase. In addition to that, people who have depression, they have alterations and disturbances in their sleep-wake cycle. And melatonin is the key molecule which actually maintains the circadian rhythm. And you can see that post-practice of yoga, melatonin levels increase. And in addition to that, we also know that melatonin is a very potent antioxidant, and its highest concentrations are found in the mitochondria. And therefore, this also helps to maintain the mitochondrial integrity. And we again find that with depression, the people tend to age faster because there is oxidative stress, and there is a decline in the telomerase activity. And post-practice of yoga, the telomerase activity and their increases, and the telomere depression. The levels of stress hormone cortisol goes down. High levels of cortisol is associated with inflammation. You can see here the levels of inflammatory cytokines go down. The levels of sirtuins, which are the defense molecules, which are also known as the longevity genes, they go up, and there's also improvement in the mitochondrial integrity. And these changes are occurring irrespective of the genotype. So whether they have a susceptible genotype or they are having depression due to other causes, all these cases, they show a remission. Whether it was mild, moderate, or severe, we find that the number of cases showing remission is actually double the number of cases who are just on drugs. And this is very important because people use cognitive behavioral therapy and drugs to treat, but this is very important to understand that yoga targets both the mind and the body as very, very effective in the treatment of depression. And we find that all 4 domains of quality of life actually show an improvement post-practice of yoga. And another thing we wanted to show you that these complex lifestyle diseases, which used to occur at about 65, 70 years, now is occurring in children, and young people are having strokes and myocardial infarctions. And it's been seen it's because of an unhealthy lifestyle, sedentary lifestyle. And you can see that yoga actually helps to reduce your biological age. And accelerated biological aging is one of the causes of early onset of these complex lifestyle diseases. And one of the theories of aging is that there is the dysfunctional mitochondria, which are producing more free radicals and less amount of ATP. And we see that as the mitochondrial integrity improves, the functional decline in the various tissues decreases. The levels of oxidative stress decrease, free radicals decrease, the total antioxidant capacity improves. Therefore, this helps to slow down the rate at which the telomeres are aging. And because there is increase in various factors which are promoting neuroplasticity, this helps in nourishing the neurons, better synapses. And these are actually not only the chemicals in the brain which are increasing, there are anatomical changes in the brain. So the side which is for stress and fright, the amygdala, it shows a decrease in size. The prefrontal cortex, which is the side for executive functioning, judgment, it actually increases in size. The hippocampus, which is for memory, it also increases in size. And the cerebellum, which is helping in neuromuscular coordination, it also shows the changes. There is increase in gray matter, and there is faster conduction because of more white matter also. So the yoga is actually bringing about not only changes in the various neurochemicals and biochemical changes, but also bringing about certain anatomical changes, which are so beneficial for us. So I would just like to end by telling you that yoga actually modulates the internal pharmacy. And therefore, it's our choice whether we want to adopt yoga so that we can switch on the epigenome so that it actually switches on gene programs which are beneficial for us. Those gene programs which will decrease oxidative stress, decrease inflammation, maintain immune homeostasis, promote neuroplasticity. So it's our choice that since we know that yoga promotes health, prevents the onset of diseases, that it's our choice whether we adopt yoga or we continue with the lifestyle that we are living and then be more susceptible to these complex lifestyle diseases. Thank you. Any questions?
Okay, Rima, first of all, can you continue your slides?
No, that's
no,
all.
Beautiful slides, no? Okay, so if this is the last slide, yes, that's great. Yeah. Okay,
I have a question. Maybe, Dilip,
yes, go ahead.
Can I ask?
Can you introduce yourself first?
Yeah. This is Deepak. I'm the president of Taksha Institute. Anyway, a very lovely talk. I need to ask a lot of, I've been thinking about this for a long time. What is called the inheritance epigenetics, and a term that is used. And that is, the story came out that a family of 20 were all born, they were all thieves. And this psychologist studied how come, and they never connected the two. At that time, epigenetics was not that well known. What do you think? Is that possible that it can happen when two sets, a woman and a man gets married? Their genetics for 3 generations there were 20 people in that generation that were thieves.
That's a good question. Actually, it's been known that epigenetics is transmitted across generations. Oh. And they have done various studies where they have shown that adverse childhood events or the way they are brought up actually modulates their epigenome in such a way that it shows up maybe many decades later. Yeah. And these changes are then transmitted across various generations. So certain behaviors actually determine how, they say your choices and your behavior actually determines how your children and your grandchildren behave. So probably that's the cause.
Because that's why we believe, like Native Americans here in the US, that we are product of 7 generations. And they have done study on rats that were given, electric shock when a rat went near the cheese. 7 generations of that rat never went near the cheese, and the 8th generation went. So this is a psychological study. Anyway, I want to pick it up later, anytime.
Yeah, this is very, very important. And, this highlights, actually, this is a very important point because this study was done on male mice, right? And they actually showed that this biological parenting begins much before conception. It actually begins when parents themselves are conceived. So it's so important that even when children, when teenagers start smoking, consuming alcohol, doing drugs, each experience is marking their epigenome, which is going to be transmitted to their germ cells. And they don't realize it. So just before planning to have a child, they improve their lifestyle, they stop smoking, but they don't realize that every experience has lent its signature. So it's very, very important to understand that.
Good.
And
Excellent.
also important that men should be aware of this, that they are actually equally responsible rather than just blaming the women.
Yeah. No, no.
The fathers are responsible.
Thank you.
This is Dilip. Already met Rima. Rima, we have a couple of physicians here who have joined. I see Dr. Dada here. I know for many of you, I'll just make a comment and then I'll ask a question. My comment to all of you is, it was an excellent presentation.
Yeah.
And when, I heard her before, and it shows what is the depth of her research and what a, powerful presenter she is. Except many of you felt that this is maybe a little too medical for you. Okay. Let me tell you just a brief one sentence, what is all boils down, how we talk to the common people. People all think about genetics. Okay, my father has a diabetes, I'm going to have a diabetes. Okay, my father had 2 children. One child had a diabetes at the age of 30, one didn't have a diabetes until, or may not be, until 60 or 80. So the question here comes up is that the genetic mutation, genetic changes are not the destiny. What is destiny is called genetic expression. The gene has to express. And the way the whole epigenetics is, the epigenetics really prevents that genetic expression. Just a simple term. I'm not talking about medically, the way she explained. So the answering to that is that both yoga and Ayurveda, both have the same origin. It's a Vedic origin. And both are, you can tell about, it is a epigenetics. It is the science of epigenetics. So what Rima Dada was explaining to you, that how yoga through this epigenetics has done this thing. So remember one thing, if you have any genetic predisposition for a disease, that is not your life sentence. Yoga will, the daily practice of yoga, we call it today, is a primary prevention. It will prevent you not to have the disease. Secondary prevention, when you have the disease, it will literally reduces the progression, it can reverse. Tertiary prevention, it will prevent the complication of the diseases. Now, my question to Dr. Rima Dada is that we know all about this. We have seen all the papers, yoga is doing this, developing neuroplasticity, all these things is happening. Now, in our big practices here, in a big, group we practice, people get a beautiful, beautiful effect of yoga, and they stop doing it. Attrition rate is also a little bit of high. I don't know what is your experience is. I can tell you about a little bit of our experiences, that we have seen the continuation of the effect of this yoga for a long, long time, even after they stop practicing yoga. Can you make a little comment on that somebody who had developed this, I don't know what kind of molecular changes they have when they stop it? And is it going to come back right away, or just give me your thoughts?
What I wanted to first emphasize is we have to practice yoga daily. We have seen in our studies that the effects do last, they continue for 2-3 months, but then it keeps on declining. Because yoga is a lifestyle. It's not what we just do on the mat. It's the way we behave, what we are eating, everything, encompasses to make this the yogic lifestyle. And what's important is that we have many times got this question that what is the minimum time that they should practice yoga? Now, somehow we have a fixed thing that yoga is just the asanas, but it's important to understand it's not just the physical or the asanas part of it, but that's just to help you to align your body so that you can breathe more effectively and get into a meditative state. But we say that even if you do 20 to 25 minutes daily, one day we say you do forward and backward bending, one day you do lying on your stomach and on your back, the next day you do sitting ones. But along with that, you must do pranayam and meditation. And meditation is just with the awareness on your breathing practice. Just awareness on your breath. You don't have to focus on your breath. Just be aware of your breath, inhaling and exhaling, with the exhalation being longer and slower as compared to that your inhalation. And that's all that is required. A minimum of 20 to 25 minutes in a day, practiced regularly, is enough to see the effects. And I was just hearing yesterday that in NIMHANS, they have started making people do yoga, the breathing practices just for 5 minutes twice a day. And there are very, very, positive changes. And then there was a thing that the practice of 3-6-5, that do it 3 times a day, try to get your breath 6 times a minute, and do it for 5 minutes. That's all. And you will see the changes. So it's very, very important that do practice yoga regularly, or even if you do it for a short duration, but it must be regular. Practice regularly.
Okay, and another point, for all of you to take home, and I'm just making a comments because exactly what she said, that yoga is we call it a daily routine, for dinacharya, your lifestyle. And once you start doing it, we always say, Karo Yog, Raho Nirog. This is our words. But the one, very simple way to, explain, I'm a physician, that a disease care you can buy. You can go to a doctor, pay him, go to a hospital, not. But what she's emphasizing, Nima, is that health is a self-care. That is the title of a talk. That means health, you have to earn yourself. Nobody's going to give you the health. Mm-hmm. And that's what her point is. The most important point for all of you to take home. The title of the talk is, your health is your choice. That means your self-care. So this is a very, very important point for you to take home. And since this is a little bit of a medical talk and discussion, if I can ask, if Dr. Heda, can you hear us? Do you have any comments or any questions for us? He's a cardiologist. He's a very expert in yoga, a practicing cardiologist. No, I don't think. Do you see anybody, Dr. Heda? Dr. Heda, do you see us?
Yeah, Dr.
Okay.
Dr.
Okay,
Sarkar, I'm hearing very well. I was little late in joining. I really enjoyed the talk, and I have one question. I have one request, and then followed by the question. The request is, I would like to have Dr. Dada's talk somehow. Can it be made available so that I can share with my colleagues who are interested very much? Did you hear me, Dr. Sarkar?
Yes. Dr. Heda, the talk is being recorded, and I believe Ravi has already set it up in a recording mode, so it is being recorded. And then once we have it ready, then we will be able to upload it on YouTube.
Thank you very much. I really enjoyed your thoughts, your way of explaining, and make it very simple. So I'm very grateful that you were able to deliver this talk on this wonderful day.
Thank you so much.
Thanks.
Thank you, Dr. Heda. She's been doing it for a long, long time, So thank you. Thank you, Dimat, for coming and talking to us. Abha, you have any comment, question? Anybody else have any question?
Well, first of all, thank you so much, Dr. Dada, for your excellent presentation. And I'm thankful to everyone else who is joining today. And sorry about the technical glitches initially, but this is all a warm up for the International Yoga Day that's coming up on on Tuesday. June 21st, that's our summer equinox. So very excited about that. And we have some more activities planned for that. Let's see if anyone else has any questions or comments. Let's see.
What is Dr. Stephen? Dr. Stephen Abiraj, he always listens to us. He's from Trinidad.
Yes, I'm not a doctor. I'm an information systems manager, so I'm not medically trained. But I did make the comment that it was very easy for me to follow the presentation, so it wasn't too medical.
Thank you.
He's joining us from Trinidad, and he joined us all the time.
So and we again, have a very international audience.
And just to mention all of you, that what Dr. Dada is saying, next week, I've been invited by the American Association Physician of Indian Origin, and the title of my talk is a healthy self-care routine, exactly what she's talking about. So even the physicians today has started learning that yoga is not only the asanas, even not only the pranayama, not only the asana, pranayama and meditation. It is a daily routine. It is a lifestyle. And the way, I don't know if I can explain to you a little bit more to all of you, the way it works is that if you start doing a physical asanas, suppose you are trying to touch your toes, called Padahasta asana, today you cannot do it. But when you keep doing it in stages, the no pain, the effortless breathing, one day when you're able to touch the toe, suddenly what happens, I think it comes to your mind, I can touch my toe. Let me see, what is my sleep pattern? Let me see what I'm eating. Let me see, it's all introspection, looking inside, we call it self-realization. Basically, as I said, realization means having eyes looking backwards to start looking inside. And that's exactly she's trying to say, that please continue daily practice. There is no 3 days a week, 3 days of yoga, 7 days yoga. It's a daily practice, a daily routine, daily lifestyle. So anything else from anybody, Abha?
Dr. Sarkar, we have a Zoom user who has a question. I see the raised hand there.
Hello.
Okay.
Hello, can you hear me?
Yes, go ahead,
okay.
Please.
So my loved one was recently diagnosed with leukemia, and there is a genetic mutation that occurs called the Philadelphia chromosome, and the treatment from the medical community is a pill. It takes several weeks to take effect. And I have practiced yoga in the past with Dr. Sarkar's phenomenal classes. Thank you. And Abha's classes on YouTube. Thank you. And I'm trying to work this into our relationship. And so I was drawn to this presentation with the link to DNA and genetics, et cetera. So is there any, obviously everything counts. Is this true? Our food choices, our stresses, our managing of this diagnosis. Is there any advice all of you are willing to offer for encouragement for the caregiver and for the patient who is suffering from anemia, et cetera, things that go along with this diagnosis, which has just occurred?
Firstly, I would just like to tell you that when we talk of complex diseases, there are a number of genes which come into play, and each gene has a small additive effect, and they may not be causal. They are just increasing your risk and susceptibility. However, in certain cancers, like in breast cancers with BRCA gene mutations, or you have, like in CML, you said the Philadelphia 922 translocation is there, which is responsible for CML, or the Philadelphia chromosome. Now, these mutations are so highly penetrant that if they are there, the person does have that health issue, does have the disease state. So, but yoga definitely will help because it will switch on gene programs. For example, the DNA repair genes, their level of expression would go up, which we have seen in various diseases. And so this will help to improve and, which will help to improve the DNA integrity, which will help to sort of increase the immunity in such a way so that and activate the stem cells, which are going to help actually in the growth of good cells. So definitely yoga is going to help. And if the person has anemia, there are various things you can have which can, because you said different modalities. For example, there are certain millets like ragi, which help to increase the hemoglobin, and is found to be very, very beneficial, and green leafy vegetables and all, which are helpful.
What was the first thing you suggested to increase the hemoglobin? I got the green leafy vegetables. What was the first?
I do not know what is it called in English, but it's that the millet, which is known as ragi. It's brown in color, and it's very, very beneficial to increase your hemoglobin. I think Abha or Sir Dr. Sarkar can find out the name, and it's ragi, R-A-G-I.
R-A.
GI.
Isn't a millet?
Yes, some finger millet or something, and it helps increase your, ragi malt, or even if you people like at home, we have ragi chapatis or ragi bread. They are very, very good to increase hemoglobin and combat anemia. It's one of the best.
Okay, great.
Abha isn't from the Punjab area, millet ragi?
And
we don't have any.
Very good.
We don't have it.
I'll find the name, and I'll find the name and send it to you in English.
Thank you.
Okay.
This finger mill. Okay. Excellent. Okay. Thank you. That's great.
Yeah, Dr. Rima, there's one more question from another participant. It's asking, can you please give us the reference to effect of yoga on eye pressure? And if you have a reference, can you type it in either the chat, or maybe you can email, we can email it to him later. If you could please type them in the chat, he says that will help.
Actually, if you want these, all the papers that I have quoted, you can just put on PubMed Dada R, D-A-D-A-R. So you get all the papers that we've published. And this work on glaucoma and the intraocular pressure, I had put it in the slides itself, that paper, American Journal of Ophthalmology, that way. So it's there in the talk.
Yeah, the question is from Stephen. Stephen, Dr. Dada actually is a world authority on effect of yoga on glaucoma. She's literally she's an authority. So if you have to keep in touch with her, look at all the papers, it'll help you a lot.
Very much.
Others, if you're talking, unmute yourself first. Others, unmute yourself before you talk, please.
Oh yeah. Can you hear me?
Yes.
I'm interested in knowing the effect of mudras. Where you touch your fingers and do Kapalbhati. Is there really? I'm fascinated how you can do DIV, do it yourself. Health in your hands. How does it work? Give me some. And Dilip is the one who really pushes that 10 mudras. Have you ever studied that?
I think Dr. Sarkar would be the best person to answer that. But for Kapalbhati, they say when you do deep breathing, it actually activates various subcortical centers, the limbic centers. And they've seen that nasal breathing, when you inhale, take a deep breath, hold it, and that's how it causes parasympathetic, activation and parasympathetic dominance, because it activates the subcortical centers. Nasal breathing, not mouth breathing. And that's how Kapalbhati is useful. Firstly, it helps to push out the carbon dioxide. and then we can fill our lungs with oxygen. So that's how the effect occurs. About mudras, I'm not the right person to answer.
Okay.
We talk about all the time. We give the scientific explanation. I know, and I'm from a medical background, so I do connect. But I think one of the person, you might know him, remember, Dr. Vinod Deshmukh. He's a neurologist from Florida. Actually, he just wrote a chapter on Charlie Dellis' book. I don't know if any of you know him. He is a daily yoga practitioner, and he understands, and he's a neurologist. He connects. So others, I'll connect you with him.
Okay, good.
Vinod Deshmukh, and you'll get more. And what I tell and what I practice, I do it in my class all the time, and I have all of them in YouTube. Effect of mudras, the scientific explanation, and how it affects different diseases.
The reason is that they can consider this Prithvi mudra with diabetes and balancing effect. And that's, I'm curious. That's all. That's got me raised. Anyway, continue.
All the mudras. We'll talk about another day. It is not the time. So, okay. So we're coming to the end of our session. So, any other comments? Abha, you have any final comments? Or anybody else have any other questions? And Abha, do you see anything in the chat box?
Yes, that's what I'm just checking.
Yeah, check if there is another question in the chat. A lot of people are shy to talk.
Ragi is finger millet, and it is available in Indian stores, at least here in Virginia. There are Indian stores, and it is available, ragi flour. So
even on Amazon.
Yeah, that's what it said. Is it Amazon on Amazon.com?
Great. Yes, thank you for that fascinating talk. And it was very informational, very helpful, and very motivational too. So we really appreciate it, and appreciate everyone else joining in. So thank you. And so like Dr. Sarkar said earlier, karo yog, raho nirog. So let's continue with that. Keep practicing. Stay healthy, stay safe, stay well. Thank you everyone for joining.